Today I met with Bo Little. He is my patient that I fit 2 weeks ago with brand new hearing aids. So at his fitting, we really just took the time to make sure he was comfortable. We don't introduce too much at the first appointment just because we don't want to overwhelm the patient. And so he was out and about for 2 weeks doing his daily routine. And then today he got to report to me how everything was going. So how you been hearing?
Better.
Okay.
But it could be a little louder.
Okay, so.
I'm still having to hum a little bit, but it's a lot better.
He said he wanted a little more volume. That is to be expected because when I first fit the patient, he sat at a lower level. And so today we were meant to increase that level. So the reason for that is so that we don't overwhelm the brain with too much sound. We like to take this process very slowly. However, the patient was ready for more today, so we were right on track. Have any sounds been too harsh for you? Okay, good.
Amber alert.
Amber alert coming through on your phone?
Oh yeah, Amber alert came across my phone.
Okay.
Yes.
Okay, so.
I remember that the other day.
There's a couple things with the phone settings. We can and can't turn certain things off and on. So you can always call AT&T or whoever you got your phone from, wherever, and say, hey, how do I turn this off or turn it down? Because that can be loud in your ears.
Yeah.
Okay. So it's my job just to hear out what the patient has to say, how his experience has been, and then we start making adjustments to fine tune the hearing aids to how he's going to hear the best. And has it been fitting in your ears okay?
Mm-hmm.
Okay, good. So one more thing I'll show you. In your case, you have a little screen right here. It actually pulls down like so, okay?
Yeah.
So I want you to put this little piece, just slip it behind here.
Yeah.
So this is meant to pull any moisture away from the hearing aids.
Yeah.
So while it's sitting up here, you just close it, and then it's going to continue to pull moisture away from the hearing aids.
Okay.
Okay. All right, so I can see that you've been wearing them for about 12 hours a day, so that's good. I do have a spy that watches how often you're wearing them.
Yeah.
So keep that up. That's the most important part. All right, so again, you were at 80% last time. I'm gonna move this to 90% of your prescription, just so you get a little more volume like you wanted. All right, I'm gonna have you put these back in your ears. Do you need a mirror?
No.
Okay. So I did turn it up a little bit. I'm just talking in my normal level right now. Is it pretty comfortable here?
Yes.
All right, I am gonna clap my hands. I just wanna make sure you're not jumping out of your skin with loud sounds, okay?
Okay.
Is that okay?
Yeah.
Good. So I'm gonna leave this here, so I'll save it. The hearing aids will turn off and back on, and I'll have you get your phone out so we can double check the Bluetooth setting.
Okay. The echo in my voices came back.
Yes, so that's very, very normal.
Yes.
Whenever you put the hearing aids on first, like you had, you're gonna hear your voice that way because your voice is the closest thing to that microphone. Now that we've turned it up some, you're gonna have to go through that process again, but over time it will get easier, okay? If it still bothers you in about a month, then we do need to make adjustments, but as long as you're wearing them as much as you can, then we're good to go. So I did turn it up a little bit. I'm just talking in my normal level right now. Is it pretty comfortable here?
Yes.
All right, I am gonna clap my hands. I just wanna make sure you're not jumping out of your skin with loud sounds, okay?
Okay.
Is that okay?
Yeah.
Good. So I'm gonna leave this here, so I'll save it. The hearing aids will turn off and back on, and I'll have you get your phone out so we can double check the Bluetooth setting.
Okay. The echo in my voices came back.
Yes, so that's very, very normal.
Yes.
Whenever you put the hearing aids on first, like you had, you're gonna hear your voice that way because your voice is the closest thing to that microphone. Now that we've turned it up some, you're gonna have to go through that process again, but over time it will get easier, okay? If it still bothers you in about a month, then we do need to make adjustments, but as long as you're wearing them as much as you can, then we're good to go. So just an overview of what we did today. I did increase up to 90% of your prescription. Over the next 30 days, you'll eventually reach 100%. Keep in mind that is based on wear time. So you're wearing them appropriately. Just keep that up and you'll notice a big difference over the next month.
Yeah.
Okay.
I think there was one day I didn't wear them and I had a earache in one of my ears and I just left them out that day.
Okay. Yeah. Do you think it was caused because of the hearing aids or was something going on?
It was just probably a head cold or something. Just
Okay.
sinus infection.
Okay, gotcha. Has that improved?
No, just that one day.
Okay.
Yeah.
Okay. Well, if you still notice any issues like that, you can always see the ENT.
Okay.
Okay. Do you have any other questions?
No, ma'am.
All right, so the next step, we'll set you up for another follow-up appointment in about a month once you've reached your full prescription, just to make sure everything's going okay. If you say, hey, I don't need that, you can always cancel it, but I like to just get it on the books, okay?
Okay.
All right, so I'm gonna look out at about a month away. At the end of the appointment, we did schedule a follow-up appointment. So in about 1 month, he will return. At that time, he will have met his full prescription. The hearing aids, we can actually set to automate to reach their full prescription gradually over time. So again, the brain can get used to this sound. At that appointment, we'll just make sure everything's going okay and that he's comfortable. If you're not comfortable, you're not going to wear them. So that's why it's important to really check in with your audiologist and just see, hey, could we make things any better? All right, so today we're following up with Bo Little. He is here for his final hearing aid check. He's been wearing the hearing aids now for about a month or a month and a half. Last time I saw him, he was having some trouble connecting his phone to the Bluetooth option on his hearing aids, but he contacted Phonak and he kind of reviewed the website and he got everything fixed himself. So today was just a follow-up, making sure he's hearing okay and that everything is comfortable. So if you ever have Bluetooth trouble again, obviously go to Phonak, but I can do it here for you, so glad you got it worked out.
Yes.
Bluetooth can kind of be a beast at times, but when it works, it's great.
Yeah.
All right, so I'm gonna have you take your hearing aids out for me. So while that's connecting, I'm just gonna take a peek in your ears. Make sure everything looks okay. All right, that looks good. All right, both ears are nice and clear. All right, so outside of the crackling sound you hear when listening to music, just in general every day, does it seem like you're hearing a little bit better?
Yes.
Okay. Would you want the volume increased or
Yes.
kind of you want it turned up? Okay. All right. So I'm going to get you to put these back in your ears. That's your right. Have you noticed a difference? Yeah? Good.
You can hear me a lot more when I'm on board.
Now you got to watch what you say.
Yeah.
Okay.
Okay, so what I'm going to do to kind of help combat that static sound you hear when you listen to music, I'm going to add a different program for you. It is called Music, so it should help kind of open the hearing aid up so it's listening for more pitches outside of just speech sounds. That will help when listening to the TV as well. Okay. So just kind of play around with it. And just because I'm adding this program, I'm going to give you one more. It's really popular. It's just for noisy situations. So if you're in a restaurant or around a group of people, you can switch into that one and it will help kind of focus on the speaker better. Okay. And I did make a couple of adjustments just in your normal everyday program to help with that static sound. So hopefully you'll notice improvement. If not, just let me know. We'll keep working on it. Okay, everything looks good so far. All right, so I'm going to save this. You'll hear the hearing aids turn off and then back on. And I want you to grab your cell phone so I can show you how to change in your app. Okay, so to access that different program, yep, you've got your music and your comfort and noise. So those are just ones that I built. It doesn't mean you can't use all the other ones listed.
I've built some.
I can see that. That's good. That's good.
Yeah.
All right. So yeah, you can click through those. You know, it doesn't matter if it's labeled music. Doesn't mean you can't use it in a different situation.
Yeah.
So click through it, see if you like it. You know how to kind of do everything else I showed you last time.
Yes.
If you have further questions, you can let me know or call Phonak. Their site is clearly pretty good, so that's great.
I was in an explosion and my hands don't work like it used to. Can you show her how to change the screens?
Yes, absolutely. So let me go ahead and show you that. I will show you. Okay, yep, you can take one out and I'll show you. You don't have to use yours. Let's save those up. You just kind of lay it on your hands and then you're going to spin the top. You want to spin it until you see where that trash can is. Number 1 is empty because we're going to put the old filter into that trash can.
Okay.
Number 2 is new, okay? So what I want you to do is actually remove the tip from the hearing aid. So I'll show you what to do.
Okay.
Don't be afraid of it, but when you're at home and you are taking this off, you want to do it over a table, probably with a towel over it.
Okay.
So you just want to get a good grip on this and then pull it off, okay? And then we'll set this piece on the table. So go ahead and try that with yours. And if it gets tough to grab, you can always put a tissue over the top of it, just because they can get slippery.
Yeah.
There you go. All right, I'll hold on to that for you. Okay, so now we're going to change the filter. So right in here is a tiny white dot.
Yeah.
So that's the part that we're going to remove. So again, you've got your number 1 here with the trash can. So you're just going to put this straight in and then pull it right back out. Okay, so there's nothing in there. And then we're going to go into number 2 to get the new one.
Okay.
And that's it. And then of course we scroll to get to the next one. So I'm going to let you scroll to get to the next. Perfect. All right, you got it. So I'll take that. And then the next step, we just have to put this guy back on. Inside there's a tiny little well. So you want this guy to fit right into that well there and then just kind of push. I like to give a little tug to make sure it's on nice and tight. So I want you to try it as well. Okay, perfect. You feel comfortable with that?
Yeah.
All righty. So you are where you need to be, but it doesn't mean you have to stay exactly there. That's why I just like to ask, do you feel like you need more volume? So you're just a notch above your full prescription. So you're doing fine.
Okay.
Okay? All righty. I'll walk y'all to the front. That's it. He's doing great. I'll see him again in 6 months.
Hi, I'm Oya, the speech pathologist at the ENT Institute. I'm meeting with a patient today. They're coming in for a swallow test. He hasn't been eating. He had a stroke and he has swallowing issues. He has some speech issues as well. Did you have to drive yourself? Or
no, but they
somebody
were
did come in?
late, and his helper, medical aid, did not come this morning, so I had to get him ready. Then he had therapy before he came here, PT
he did?
and OT.
Okay.
It's been a morning.
Are you tired? You're gonna take a good nap when you go back. Okay, see if you can push against the tongue blade for a second. Push, 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 push. Oh, good. Okay, all right. See if you can push this side. Push, push, push. Push towards left. There you go. Okay, push towards right. Okay, all right, very good. Let's do this one more time. So what we're gonna do is a fees swallow study. So this does require a scope going through your nose. Okay, do you remember that, right? So just, make sure you're relaxed. I can put a little lidocaine jelly on the scope to make it a little bit more comfortable, okay? Okay, so I am now performing flexible endoscopic evaluation of swallow, and usually we call it FEES. So this test assesses the swallow function. The patient is being scoped as they are eating and drinking foods and liquids, and it objectively assesses how their swallow is functioning. Tilt your head up a tiny bit. Perfect. Very good. Okay. Oh, it's wide. Nice open in there. Beautiful. Okay. Say Ka, 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 ka.
Ga. Ga.
Okay.
Ga. Ga.
Perfect. Beautiful. Okay, say E one more time.
E.
Again.
E.
Good. Again.
E.
Great. Okay, that's it. Okay, we are gonna start with let's start with water. Let me move a little bit forward like here. All right,
gonna
you're
take
gonna
a
drink
tiny
some
sip.
water, okay? You might want to go ahead and swallow again. There you go. Okay. Let's go for peaches. Wow. Wow. What? Peaches. Let's do
Okay.
like let's start with small and a tiny bit of juice with it too.
Okay.
Like one small.
Maybe okay.
It's coming.
2 peaches. It's a whole spoon. Ready? Chew, chew, chew. This is a fun test.
Mhm. Was that too large of a sip?
Oh, no.
No. So this patient is able to swallow pureed consistencies of solids and liquids that are thick, which are called honey thick liquids. He does continue to have some trouble swallowing these consistencies, but as long as they're very tiny bites and very small sips, he's able to tolerate them. Okay, we are done.
Good job, babe.
Wow.
What you smiling for?
Okay. Hope that wasn't too bad.
No.
No?
No.
When he's been scoped before, it's been way
You've
more
been
traumatic.
scoped before.
But it was way more traumatic. It wasn't anything like this. That was much more pleasant. Yeah?
Simple.
Simple.
Simple. Simple.
I think it's Oya's got a light touch.
Yeah.
Yeah.
There were, so these are our vocal cords,
yep.
right? So that's the right one. This is the left one flipped. And then there's something here. That's the epiglottis.
Got it.
So our epiglottis sits here.
Yep.
And as we swallow, it has to
Cover.
cover everything. While it's doing that, when we initiate our swallow, this area, our throat basically squeezes like this. So, and then, the epiglottis folds over to open the food pipe, and then things go through the food pipe. So this area should be perfectly clear.
Covered.
Like on the sides, in the back, and in the front, everything should be covered perfectly.
Right.
What's happening is that his epiglottis isn't inverting perfectly. That's sometimes that'll be due to, it's normal that, it might be due to stroke, could be due to weakness in that area. So what we want to probably try to continue to do, those effortful swallows, we want epiglottis to continue to go a little bit further, close everything down, and then this area to squeeze better. Stronger, better, but then the delay. So you're not, when you're initiating your swallow, it's taking you a while to initiate. While you're waiting, or while the swallow is trying to work itself out, the foods and liquids start trickling down from the sides. And they're almost like they're coming down from the top. They're going all the way around, and then sometimes going in towards your vocal cords, which has your airway. So if they're going below your vocal cords, that means aspiration, things are going down to your lungs. So
Which we don't want. So would that be a smoothie?
Smoothie is tricky because it's, it contains ice and that gets thinner. I would do, for honey thick, you mean? For honey thick, I'm gonna give you guys some information on it.
Okay.
Yeah, there you go. I would probably purchase thickener. So there are like thickener powders you can get from any type of pharmacy. We have had some progress because he wasn't eating or drinking anything before. as he has a peg tube, a feeding tube. So what we will be doing next is have him start eating these things in very small amounts so that we can get the swallow function a little bit better, and we will be doing a lot of swallowing exercises to strengthen his tongue muscles, his throat muscles, his swallow muscles, just overall the swallow function, so that at some point in the soon future, he's able to get on a real diet and start eating foods and liquids.